In this section, we'll be covering different steps in the cardiac cycle, as well as where the heart sounds fit into that cardiac cycle. The next section is entitled The Cardiac Cycle and Heart Sounds. The cardiac cycle can be divided up into 7 phases that repeat themselves over and over again. Classically, the first phase is called atrial systole. This occurs when the atrium is contracting. The second phase is isovolumetric contraction, which is the first part of systole. The third phase is rapid ejection. The fourth is reduced ejection. Both of these also occur during systole. Diastole starts off with isovolumetric relaxation, then rapid filling and reduced filling. This diagram shows systole and diastole on the top with left ventricular pressures. The left atrial pressure on the bottom, left ventricular pressure in red, and aortic pressure at the top in dotted black. The left ventricular volume can be seen just below that. As you can see, during systole, the left ventricular volume decreases. The left ventricular end-diastolic volume, or LV-EDV, is seen at the top of the graph, and the LV-ESV, left ventricular end-systolic pressure, is at the bottom. During diastole, the left ventricular volume increases. Then at the bottom of the chart you can see an electrocardiogram and the heart sounds, and we will talk about these. Again, the cardiac cycle begins with an action potential from the sinoatrial node and ends just prior to the next action potential. The cycle length is determined by the heart rate. The cycle length can be calculated in seconds by taking 60 divided by the patient's heart rate in beats per minute. The cardiac cycle has 2 general phases: systole, which is an active process in the ventricle. Systole corresponds to when the ventricle is contracting, and this is 1/3 in general of the cycle length. Diastole, however, is 2/3 of the cycle length and occurs when the ventricle is relaxing. As you can see, ventricular relaxing and filling is very important for the cardiac cycle. The right side of the heart and the left side of the heart both undergo similar cardiac cycle events. The right-sided pressures generally, however, are 1/4 the left side. This diagram shows atrial systole in the section marked A. Atrial systole is the end of ventricular diastole. Atrial systole occurs immediately after the P wave on the EKG, and it causes the A wave on atrial pressure tracing. At this point, the atrioventricular valves, or the AV valves, such as the mitral valve and the tricuspid valve, are open. Atrial systole is actually just a minor contributor to LV filling. The next section, isovolumic contraction, occurs immediately after atrial systole, and it follows ventricular depolarization. The mitral valve closes, and the first heart sound occurs. Because the aortic and mitral valves are closed during isovolumic contraction, the volume of the left ventricle stays the same. The pressure, however, rises rapidly. Isovolumic contraction ends with the opening of the aortic valve. This is considered to be part of systole. You can see here in this diagram, in the section marked B, isovolumic contraction. Left ventricular systole then continues with ejection, which is sections 3 and 4. After opening of the aortic valve, rapid ejection occurs, and a sharp rise occurs in the left ventricle and aortic pressures. Rapid ejection terminates when the peak LV pressure intersects the peak aortic pressure. This is the point where the aortic blood flow is at its maximum. When the left ventricular volume decreases, late ejection begins. This blood is distributed to the systemic circulation. At this point also, aortic and left ventricular pressures begin to fall. Ejection ends with aortic valve closure. In this graph you can see under section C, rapid ejection, with an increasing flow rate out of the left ventricle. Under section D you can see reduced ejection, with a diminishing flow rate out of the ventricle. It's important to mention at this point stroke volume, which is the volume of blood ejected out of the ventricle, is generally approximately 60% of the end diastolic volume. The amount of volume left after systole is the end systolic volume. We calculate stroke volume by taking the EDV minus the ESV. Normally this value is approximately 50 to 60 milliliters. We can also calculate the ejection fraction by taking the stroke volume and dividing out the end diastolic volume. A normal ejection fraction is 55 to 60